Understanding kidney stones, causes, symptoms, and treatment. Did you know that kidney stone problems send over 500,000 people to the emergency room every year? And it seems like kidney stones are becoming more common nowadays. In the late 1990s, only 5.2% of people had them. But fast forward to the early 2010s, which had increased to 8.8%. And if that's not enough, a 2020 study estimates that the lifetime risk of developing a kidney stone is now closer to 1 in 7. So chances are, you or someone you know will have to deal with this. But what exactly are kidney stones? Are they dangerous? And what are the symptoms? We'll answer all those questions in this video. So let's get started. What are kidney stones? Kidney stones are hard deposits consisting of minerals and salts inside your kidneys. They can come in different sizes, from a tiny grain of sand to the size of a pea or even bigger. When some substances in your urine become too concentrated, they can crystallize and stick together to form a kidney stone. Normally, your kidneys are good at flushing out these chemicals in your urine, but sometimes the stone-forming chemicals like calcium, oxalate, urate, cystine, xanthine, and phosphate don't get eliminated properly, and that's when a kidney stone can form. Kidney stones sometimes stay in the kidney without causing any problems, but at other times they can travel down the urinary tract, which leads to urine backup in the kidney, ureter, bladder, and urethra, and that's when the real pain starts. The good news is that the small kidney stones can sometimes exit the body without causing much discomfort. However, if they get stuck, you'll definitely feel the pain. Types. Kidney stones come in all sorts of colors and types, and how you treat them and prevent them from forming again depends on the type of stone you have. Calcium stone, 80% of stones. A calcium stone is the most typical type of kidney stone, making up around 80% of all kidney stones. The two different types of calcium stones are calcium oxalate and calcium phosphate. Some people's urine contains excessive calcium, which raises their risk of developing calcium stones. But even if your urine has normal calcium levels, you could still have calcium stones due to other factors. Uric acid stones, 5 to 10% of stones. The chemical processes in our bodies produce uric acid as a waste byproduct. And if our urine is too acidic, it can cause uric acid crystals to form, eventually leading to a uric acid stone. But why would our urine be too acidic in the first place? Well, there are a few reasons. Being overweight, having chronic diarrhea, and having type 2 diabetes can make your urine more acidic. And if you're a big meat eater and skimping on your fruits and veggies, that can also make your urine too acidic. Struvite infection stones, 10% of stones. Struvite stone is not a very common type. These stones are actually related to chronic urinary tract infections, or UTIs. Urine can become more basic or alkaline and less acidic due to specific bacteria in the urinary system. And when that happens, magnesium ammonium phosphate, or struvite stones, can form in the alkaline urine. These stones are often large with branches, and they grow very fast. So, who is at the highest risk of developing these stones? Well, it's people who get chronic UTIs, like those with long-term tubes in their kidneys or bladders, or people with poor bladder emptying due to neurologic disorders like paralysis, multiple sclerosis, and spina bifida. Cystine stones, less than 1% of stones. Cystine is an amino acid found in certain foods and is a key player in building protein. But having too much cystine in your urine can lead to some serious problems. Cystinuria is a rare metabolic disorder that is inherited and can cause too much cystine to be present in your urine. Normally, our kidneys reabsorb cystine to keep it from forming stones. But when we have cystinuria, our kidneys can't do that job properly. So when there's too much cystine in the urine, it forms crystals, which combine to make stones. These types of stones usually start to form in childhood. Symptoms. Small kidney stones, like grains of sand, can pass through your body without causing pain or discomfort, but kidney stones can grow as big as a pebble or golf ball. Generally, the bigger the stone, the more noticeable the symptoms. So, what are the symptoms? Well, they can be pretty unpleasant. Some people experience severe pain on either side of their lower back. In contrast, others may feel a vague pain or stomachache that won't go away. Blood in the urine, fever and chills, nausea or vomiting, and cloudy or foul-smelling urine are common symptoms of kidney stones. So, when do kidney stones start to hurt? Well, they usually cause irritation or blockage, and that's when the pain starts to build rapidly and become extreme. Kidney stones typically move throughout the body without causing any harm, but unfortunately, this rarely happens without severe pain. Small stones might only require painkillers, but more treatments might be necessary if the stones result in long-lasting pains or other issues. In severe cases, surgery may even be required. Causes. One of the biggest factors that can contribute to kidney stones is not drinking enough water. If you're not staying hydrated, your urine becomes more concentrated, making it easier for minerals to stick together and form stones. So, ensure you drink plenty of fluids throughout the day, especially water. Exercise is important for overall health, but too much or too little exercise can increase your risk for kidney stones. If you're not getting enough physical activity, your body may not be processing calcium properly, which can lead to stone formation. On the other hand, if you're working out excessively, you may lose more fluids than you're taking in, which can also contribute to stone formation. Being overweight or having had weight loss surgery can also be risk factors for kidney stones. This is because obesity and weight loss surgery can affect how your body processes calcium and other minerals, making it more likely for stones to form. Too much salt or sugar can increase your risk of kidney stones. This is because a diet high in sodium can lead to calcium buildup in the urine. In contrast, a diet high in sugar, especially fructose, can also contribute to stone formation. Additionally, you may be more prone to getting kidney stones yourself if you have a family history of them or have suffered from a urinary tract infection. Diagnosis. So, if you're experiencing symptoms like severe pain in your lower back or blood in your urine, your doctor will likely start by asking about your medical history and performing a physical exam. They'll also want to look at the size and shape of the stone in question. To do that, they might order a high-resolution CT scan, which gives a detailed picture of the kidneys, bladder, and surrounding organs. Or they might do a KUB X-ray, a kidney ureter bladder X-ray. This can show the size and position of the stone and can help determine if it's suitable for shockwave treatment. Once your doctor has a good idea of the size and location of the stone, they'll evaluate your kidney health with blood and urine tests. Then, they'll decide on the best course of treatment for you. Your doctor may advise drinking lots of water to aid the stone's natural passage, depending on its size and location. Or, they might suggest shockwave therapy, which breaks up the stone using sound waves. Surgery can be necessary if the stone is too huge to pass naturally or with shockwave therapy. Your doctor will want to figure out why you developed a kidney stone in the first place. Then, they'll analyze the stone and test your blood and urine for calcium, phosphorus, and uric acid. Treatment. The good news is that treatment is similar for both kids and grown-ups. Your doctor may recommend drinking much water to naturally flush out the stone. And if your urine is too acidic, they might give you medicine to balance it out. But sometimes, the stone is too big or causes too much trouble, and surgery is the way to go. One cool, non-invasive option is called a shockwave lithotripsy. It sounds intense, but don't worry, it's not as scary as it sounds. High-energy sound waves blast the stone into smaller pieces, easier to pass out of your urine. So it's like a tiny explosion happening in your body, but it's not painful at all. Another method is called a ureteroscopy. That's where a special tube with a camera on the end is inserted through your urethra and bladder to reach the stone in your ureter. The doctor can either remove the stone or break it into smaller pieces. Doctors might recommend a percutaneous nephrolithotomy or nephrolithotripsy for really big or complicated stones. It's a bit more involved, but still pretty safe and effective. A small incision is made in your back, and a tube is inserted directly into your kidney to remove the stone. Prevention. Kidney stones can be painful and increase your risk of developing chronic kidney disease. However, there are things you may do to help prevent them from forming again. Drinking plenty of fluids, especially water, is super important. If your urine is too concentrated, that's when stones can form. So, aim for light yellow to clear pee, and drink more than 12 glasses of water daily. Plus, fruits and veggies make your urine less acidic, which can help prevent stones from forming. Cutting back on salt is also crucial. Watch out for sneaky sources of salt in things like packaged meals and sports drinks. And if you're overweight, losing some pounds can help too. But be careful with high-protein diets that include a lot of animal-based protein. They can increase your risk of forming stones. And don't worry if you hear that calcium is a problem. Dairy products can help prevent stones from forming. Calcium binds with oxalate before getting into your kidneys, which is good. Lastly, some herbal remedies claim to help prevent stones, but there's not enough proof yet. Your doctor or a certified dietitian can help guide you on what changes to make based on your specific case. Don't be afraid to ask what foods to avoid, whether to take vitamin and mineral supplements, and what beverages are best for you. Stay hydrated and keep those kidneys healthy. And that's it for today's video on what kidney stones are. If you enjoy this video, give us a thumbs up, and don't forget to hit that subscribe button for more health-related content. Thanks for watching, and we'll see you in the next one.